Hello and welcome to this week's episode of Dr. Jawbreaker. Thanks for tuning in. Remember to go down below and to subscribe. I think you're supposed to do this. Subscribe and leave a comment down below. That's super helpful. We try to get to, and we do get to, all of the comments and any questions that are answered. By all means, we'll answer those for you. Also, if you just want to email us, you can email us at info@dentistbraincandy.com, and what we'll do is we'll get the answer back to you. We'll answer you, of course. There may be something that's more personal of nature that you just don't want public, but if it's a good question and you can post it publicly, please post it below. Alright, the case that I'd like to show you today is this really nice younger lady. She's 34 years old, comes in and just failing dentition. It's really affected just her in general, her self-confidence and self-esteem, and just really her quality of life. Not to mention having teeth in this kind of state of repair is painful. She's having headaches, and that doesn't even count for the chronic bacteremia and bacteria that gets entered in the bloodstream on a regular basis because of this kind of scenario. In fact, just to kind of highlight that point, when I was doing this procedure this week, and I was taking out the lateral incisor, which by the way was just black and broken off. The one next to it, the central incisor, was also black and broken off. When I started to take it out and put some pressure on it, actual pus came out of the center of the tooth next door. Actually flowed out of the center. That's how much bacteria and infection was kind of in and around this. Got a few groans in the room. It was a little weird, but definitely know you're helping someone out when you can get that kind of infection out of someone's head. She will feel better. She will have more energy and just overall just a better sense of well-being once she's completely healed and through all of this. It's not unusual that I hear that 1 week post-operatively after getting out teeth that look like what I'm about to show you, at least radiographically I'm going to show you, that they feel just that much better, tremendously better, and I already notice the difference. Alright, so let's take a look at the x-ray here. Let's come in. What you'll see here is a radiograph called a Panorex, and it shows some earrings right here. Does anybody know what that is? You're right, it's a nose ring. And here is our dentition. Instead of using my finger, I'll use the pointer here. But you can maybe get an appreciation for just how things are in rough shape. This is the tooth right here that when I pushed on it, pus came out of this tooth, out of the center of it, and you can just see there's just really bad repair. These teeth are just in rough shape. This is the nerve called the inferior alveolar nerve, and it comes down here and exits here. Another one on this side, exits right here. These are your sinuses, not yours, but her sinuses. Sinus floor, you can see the roots are near the sinus. For those back molars as well. So now what I'm going to do is I'm going to shut this down and I'm going to open up the post-operative radiograph. So we'll be back in just a second. So we worked with a local restorative doctor. I know that there's some models out there where they have a restorative doctor actually within the facility. I find that this kind of model, in my opinion, limits the patient's options. The patient comes from their restorative office, their dentist. They have a dentist. If they go into one of these shops that takes out and does this kind of stuff with their own in-house dentist that restores it, there's really no rapport there. They've never met this person before and their choice is limited. Where in this situation, they actually get to go back to their regular dentist and have their dentist who they know, who they trust, and have a relationship with, make their final teeth. So what happened initially is this patient saw me, went then to the restorative doctor, had some impressions and what I'll call the pre-operative workup. So essentially they made some upper teeth, upper dentures and lower dentures. And what we did on day number 1 of the surgical procedure is had the patient come in, we put the patient to sleep, and we had these teeth, these new teeth, the dentures if you will, ready to go. So what we had was the dentures and the new teeth ready to go. So what we did is we put our patient to sleep with a breathing tube in our accredited facility. We went through AAAHC, which is a national accrediting board that just comes through our place, and put the patient to sleep. and took out all of the teeth, and then placed 4 implants in the upper jaw and 3 implants in the lower jaw at the same time as the extractions. We then took the upper teeth, took a mold, took an impression with those upper teeth, and the lab guy, it was Nick, I'm sure you guys know Nick. Nick came in and actually took that upper denture and converted it so that after the procedure, after she was in recovery, we were able to actually put that temporary set of teeth, which was now just a horseshoe of teeth, no palatal coverage, didn't look anything like the denture from before, and bolted down attached to her implants. We also had an impression of the lower arch and the 3 lower implants that were placed, and used a system called trefoil, and used the concepts from the system called trefoil to make a wax try-in of her lower teeth that were then tried in later that afternoon at her dentist's office to make sure her dentist liked everything. So I'm going to get a little dental on here, but basically to make sure that the phonetics, the occlusion, and the aesthetics were all what they needed to be. That is now being processed into the final restoration and will be inserted in the next week. So this patient will have her final lower teeth bolted down, attached to those implants within the first week. The upper teeth are temporary and will be worn for the next 3, 4, sometimes up to 6 months in order to establish everything that needs to be established and to get enough healing before you can go ahead and move forward and make the final teeth in the upper jaw or arch. So let's take a look at her radiograph here together. Now this is her post-operative radiograph, and it shows no teeth. And when I counted, I believe it was about 21 teeth that came out. So 21 teeth came out. You can see the sinus is right here, and the sinus is right here. You can see an implant skirting along the sinus here, skirt, and a little one right here. And then these implants in between. And you can see this right here. These are screws that actually go into the denture that's bolted down. Now the denture is mostly radiolucent. You can only catch a thin hint or outline of the restoration that's actually attached to these implants. Had to do some bone grafting, and what I did is I actually saved bone from down here that was actually reduced. So reducing that vertical height so I could place these 3 implants. I saved that, packed it in and around the implant in this area, and let me think here, around the other, actually all the implants, a little bit of autogenous bone around all of those. Okay, now down here, the nerve is right here and comes out there, and then right here and comes out there. So you'll notice that these implants are angled backwards, but not as steeply as what these are. And then this one is straight up and down. You'll also notice that these are 15 millimeters in length. These are 13 millimeters in length. This and all of these and the 2 outside implants are both 4.3 millimeter diameter implants. And this fella, although he looks smaller than these 2, is actually bigger. It's a 5 millimeter diameter implant and a 15 millimeters long. These are healing abutments that are on there, and like I said, in a week there will be new teeth bolted down onto these implants. Alright, so this patient was literally done this week. I saw her the following day. She's doing great. Incidentally, this healing abutment came loose, and she had it at home. She came in, we just had to put another one on. We had ultra long-lasting local anesthetic in place. That stuff's called Exparel, and we have a master class in Exparel at dentistbraincandy.teachable.com, and it will teach all you practitioners out there how to implement and use Exparel for every single one of your patients in a cash flow positive manner, so you're not losing money. So check it out. It allows patients to do that, and what it allowed us to do was not only have a patient that felt better the next day, and really wasn't taking, I think, 1 narcotics through the night, 1 narcotic pill, 5 milligrams of oxycodone, which is remarkable, but also allowed us to place this back in place without any additional local anesthetic and no pain. She was numb. So worked out very well. She'll be numb for 2 to 3 days. We'll see her back next week and continue to follow her until she's done. Thank you. I hope you enjoyed this week's episode, and we'll catch you next time.